So we're going to talk about the A and P of the abdominal system, okay, the systems of the abdomen, or what, as we call them. Specifically, the GI tract, the genital system, the urinary system. You have both hollow and solid organs in this system. The solid organs are very prone to injury, and as such, bleed profusely, okay? Any hollow organ that leaks, though, is going to leak whatever's in it out and contaminate your abdominal cavity. It's very important to realize that, okay? This is just a picture of the difference between the solid organs and the hollow organs. Liver, spleen, pancreas, kidneys, you know, and your ovaries, if you have them, or testes, are all solid organs. All the others over here, gallbladder, stomach, small intestine, large intestine, ureter, colon, all that are hollow organs. When those leak, they leak into the abdomen and cause major, major problems. Okay? So the GI system itself is responsible for digestion. Okay? Digestion begins when food is chewed, a process known as mastication. Say that word. The saliva gets in there, breaks down the food, turns it into something called chyme, or chyme, C-H-I-M-E, starts the process of that. And of course the stomach is the main organ for digestion. The gastric juices inside the stomach actually break food down and begin the process of pulling out nutrients. Okay? The liver assists in the digestive process. This secretes bile. It filters out toxins, creates glucose stores. So it actually stores glucose as fats in the body. Okay? And then it produces substances necessary for blood clotting and for immune function. So this is where your white blood cells come from, okay? Or part of where your white blood cells come from. Yeah. And the gallbladder itself stores bile, and it releases bile through the bile duct into the system to begin the breakdown, or assist with the breakdown of food and the moving of the nutrients out of it. Okay. You have your small intestine. It's made up of 3 parts, and the food travels into the small intestine, and that's the duodenum, the jejunum, and the ileum. And what each of these do is each one of them pulls out different nutrients as it goes, okay? As the food or product that was once food moves through that tract, each one pulls out different nutrients that the body may need, and continues the process of undulation or fasciculation, which allows the food to move, or the waste to begin to form and to move through it, okay? It allows for, the material to be utilized by the body, and next we move into the colon. And this is our large intestine. Food that isn't broken down, whatever's left comes here. The water is taken out of it, and this is where your stool is formed. Okay? This is where the poop comes from. Of course, as the water is absorbed from it, the stool is formed, and then the spleen itself, which is located in the abdomen, has no digestive function, but what it does do, okay, what the spleen does do is scrub red blood cells. Okay? But that is a solid organ inside of the abdomen. Okay? It holds at pretty much at all times about 500 milliliters of blood. The problem with that is, and those are red blood cells, so if that ruptures, the problem is it's going to leak. It's going to leak red blood cells, which means that you have a lesser amount of red blood cells to move oxygen, and you now have an open leak into your abdomen. Okay, so that's kind of a huge problem. All right. Any questions about any of the GI system as of yet? No? Then we move into the genital system. Now, the abdominal space holds the GI system and the GU system, okay? The genital system as a whole, we're going to delve into it in a little bit, but we're going to talk about the urinary system first, because those two kind of coincide, okay? The urinary system has to do with the waste leaving the body, and that waste material leaving the body as it's filtered from the blood in the kidneys, okay? Of course, you have 2 kidneys, one on each side of the body. The ureters join each kidney to the bladder, and then from the bladder, it's located right at the symphysis pubis, It's protected by that bone at the front of the pubic cradle, or if you will, right in the lower abdomen. It sits behind that bone as a protective mechanism, and when it's very difficult to damage the bladder, but if it is damaged, it can cause significant amounts of significant sepsis because of the fact that you're leaking waste directly into the body. And of course, it goes kidneys, ureters, bladder, urethra to the outside of the body. Okay, kidneys, ureters, bladder, urethra out the body. All right. The male reproductive system or urinary system looks as such. Goes from the kidneys, ureters, bladder, past the prostate. Okay, this is what helps with the continence. Through the urethra, down the penis to the external urethral opening at the head of the penis. Okay. I don't think there's a lot of explanation there. Now, the patho of the abdominal cavity. Okay, there's two different parts to this abdominal cavity lining. Okay, this is known as the peritoneum. There's the visceral and the parietal. The visceral always covers organs. Parietal covers the wall. Okay, so whether it's the lungs, we have a visceral and parietal pleura of the lungs, and then you have a visceral and parietal peritoneum of the abdominal cavity. Okay, so the visceral pleura covers the lungs, the parietal pleura covers the chest wall. Same thing, the visceral pleura or the visceral peritoneum, covers the organs inside of the abdominal cavity, and the parietal covers the wall. Okay, the reason that's important is that when stuff leaks, it leaks into the space between the visceral and parietal or peritoneum. Okay. Any foreign body that leaks into there, or foreign material, blood, pus, bile, anything that leaks into there, can irritate the peritoneum and cause something called peritonitis. Okay, we're going to talk about that in a second. An acute abdomen refers to a sudden onset of abdominal pain. This has to do with something that's beginning and is going to be an ongoing or progressive problem. Peritonitis is inflammation of the peritoneum and can cause an ileus. And that's paralysis of muscular contraction that normally moves things through the intestines. Well, when that inflammation happens, guess what? The stuff that's in our intestines gets stagnant. So if you can imagine, bacteria is building up, it's already rotting. Now it's rotting and sitting still. Okay? You ever smell garbage that's been sitting still for too long? Imagine that being in your body. Imagine what it does to your body. Because what do the intestines do? They pull stuff out. So guess what it's pulling back out into your system? All those toxins. Okay?
So you could become sepsis.
Oh yeah,
as well.
very quickly. Very quickly. And the thing is, with peritonitis, something's already leaking. So you've got the leak going on, and then on top of that, you've got something squeezing against that while it's leaking. That's bad.
How long does it normally take for that to...
Peritonitis?
Yeah.
Doesn't take long. If something starts leaking, peritonitis is pretty quick.
Yeah.
Well, it's 24-hour onset, something like that. But the irritation will start immediately.
Mm-hmm.
The actual peritonitis, the inflammation, takes about 24 hours to 72 hours for onset.
So the irritation part would just be like, my stomach's hurting.
Stomach hurting, this, that, and the other, yes. Okay. When you have people post MVC that are complaining stomach pain, things like that, that's why they always do a CT abdomen to make sure that there's nothing leaking into that abdomen.
Right.
Okay. Then we have diverticulitis. And diverticulitis is irritation and inflammation of the diverticulum. This is the undulations inside of your colon. Okay? And so that's just inflammation of that. And then you have something called diverticulosis, which is where something gets stuck inside of those undulations of the colon and actually forms a pocket. A lot of times that happens with like nuts and corn and things like that, and it can cause significant problems, including rupture. Okay. Cholecystitis, that is inflammation of the gallbladder. Okay. Chole being like cholesterol. Cyst being the actual nodule, and then itis being inflammation thereof. So what happens there is that gallbladder becomes inflamed, whether it be from stones, whether it be from bile, like a blocked bile duct, things like that. It either has to be removed or it has to be unblocked, and usually they just take it out. Okay, and then you have appendicitis. And the thing about appendicitis is appendicitis is acute. The appendix is at a place in the body known as McBurney's point. It's the bottom right corner of the right lower quadrant. And I always refer to it as my favorite Irish pub, because that's how I remember it. But an acute appendix is a life threat, because if that appendix ruptures, peritonitis is imminent. Okay? Abdominal pain, there are nerves that run all throughout the abdomen. Okay? That parietal peritoneum, okay, has the same nerves that supply the skin of the abdomen. Okay, so you'll feel that pain, you'll feel that discomfort, and it'll feel like you can feel it in a particular location. Okay. The problem with the visceral peritoneum and the nerves there is it produces what's referred to as a referred pain, because you feel pain in the area of your organs. You can't really tell, like, oh, my kidney hurts. No, you feel pain in the flank, or you feel pain in the area of, like, your liver, but it's very difficult to tell. Is it liver? Is it pancreas? Is it gallbladder? You know, but the gallbladder actually has specific signs and symptoms, but the others, for the most part, do not. Okay. But truthfully, you're gonna feel all the pain the same. From the gallbladder, you're typically gonna feel pain. And again, this is why it's that referred pain, because it all travels in the same directions. Okay? This is why if you have appendicitis, cholecystitis, they feel almost the same. You're going to feel pain, upper abdomen, lower chest, and right shoulder. Okay? That's where that pain's going to be. That's where those nerves, what they call innervate. Okay? So each place that there's a juncture or a synapse point, that's where you're going to feel it. All right. Ulcers. Ulcers happen when the protective lining of the mucosa erodes. This allows the acid to eat into the organ. Specifically, there are two types that we always talk about. We talk about peptic versus gastric ulcers. Gastric ulcers are what you have in your stomach. Peptic ulcers are what you have further down in your system. Okay. Again, some of the common causes of this, like I said, are excessive acid production. Depends on the things we eat. Signs and symptoms are nausea, vomiting. You know what they call GERD, gastroesophageal reflux disease, or acid reflux, right? Some of the complications of this are eroding of the esophagus, or what we call esophageal varices, where you actually rupture it, and it causes profuse blood loss, like out of the abdomen. They're like throwing up copious amounts of blood. But it's going to be a dark red blood or sometimes bright red blood, because it's either arterial or venous. And the problem is, how do you stop it? They have to go in and cauterize it.
Yeah. There's nothing on our end.
No. The only thing we can do, I've had to intubate somebody through that while they're coughing up blood like that. They're wide awake, and I couldn't do anything but shove a tube down their throat while they're wide awake.
Hang on.
Yep. Oh yeah. Pretty much that's what happened. Okay. Gallstones, they may form and block the gallbladder's outlet, and this leads to cholecystitis. It's called the bile duct. It's what they block. And when you see gallstones, they can become large, very large. Usually they're measured in millimeters, but if you think about it, several millimeters is not necessarily that large, but a couple centimeters, 10 millimeter, 12 millimeter stone, that's a half-inch stone. That's pretty sizable. And it doesn't take much to block that duct, because the gallbladder is only about the size of your thumb. Okay. Pancreatitis is inflammation of the pancreas itself. The pancreas is what controls insulin production and the release of glucagon into the system. Okay. So this is what causes the sugar to move around your system. And so if you have pancreatitis, it inhibits the release of insulin into the system and can throw your sugar off. Okay. Appendicitis, obviously inflammation of the appendix, that is a life threat. Pancreatitis can actually be a life threat too. GI hemorrhage, Another, again, if you're bleeding out of you have a GI bleed, it can either be chronic or acute. You do have people that have a chronic GI bleed. That is a very, very telltale, if you've never experienced a GI bleed, not personally, but I mean, you ever treated somebody for one, it's a very telltale signs and symptoms. It is the worst smell you ever smell, worse than burnt flesh or anything, and there's nothing on earth like it. Like, you know when somebody has a GI bleed. You just know. Okay. We talk about esophagitis. That's the lining of the esophagus becoming inflamed. And like I said, a lot of this happens because of GERD, or gastroesophageal reflux disease. And then ultimately, that can end in esophageal varices. And esophageal varices is pressure within the blood vessels surrounding the esophagus, causing them to rupture. It happens suddenly, and it is an absolute life threat. Okay? Absolute life threat. A Mallory-Weiss tear or Mallory-Weiss syndrome is where the esophagus and the stomach tear and cause severe bleeding, where they actually tear away one from the other. And this is a medical syndrome, not a trauma situation. It doesn't necessarily have to happen because of trauma. Not saying it can't, but there's leaking that happens into the abdomen when this happens, and it causes severe bleed because the stomach and the esophagus are very, very vascular. Okay. Gastroenteritis, that's a bacterial infection or possibly a viral infection. And so what happens in gastroenteritis is inflammation of the GI tract. Inflammation of the GI tract. And so as things are trying to move through the GI tract becomes swollen, specifically the area of the stomach, duodenum, jejunum, and ileum. Okay. Diverticulitis, like I said, fecal matter becomes caught in the walls of the colon, causes inflammation. The problem is processed food. This is why that happens, because processed food doesn't have the fiber that we're used to eating. And bulges in the colon wall will result from increased intestinal contractions. The problem is that means that in the future, you're going to have far more trouble trying to go to the bathroom. I mean, like a better way to put it, right? Hemorrhoids. This is swelling and inflammation of blood vessels around the rectum. The problem with hemorrhoids is when hemorrhoids happen, that rectal blood vessel swells and can rupture. Not rupture and you bleed profusely. Well, they can, but typically they bleed just a little bit because the skin around them tears because they become so inflamed. But the problem is that you can't pass fecal matter. And so that's where things like preparation age, things like that come into play. And a lot of times, depending on the severity, they have to be removed. Okay. It's called a hemorrhoidectomy. All right. And then cystitis, which is a bladder infection. This is also called a UTI. And the problem with the UTI is the person will initially just have symptoms of, pain in the bladder, difficulty urinating, things like that. As it progresses, the patient can become septic because it backs up into the kidneys. And it's what's referred to as renal failure. Not necessarily the renal failure we commonly think of where the kidneys fail, but there's a para-renal failure, pre-renal failure, and post-renal failure. And this is what's referred to as pre-renal failure. Okay. All right. The kidneys maintain homeostasis within the body. They are what is responsible for making sure that fluids are moving in and out. Okay. Okay. When the kidneys fail, again, uremia results. And what happens with uremia is this is the urine becoming septic or the urine becoming infected. And blood, emia being blood, gets into the urine. Okay. So there's something that happens in the kidneys known as glomerular filtration. And what happens with glomerular filtration is that the kidneys filter out what the body needs, the rest becomes waste and gets urinated out. They're like the last stop on the way, for things out. kidney stones or renal calculi.